My name is Erin Carey. I'm the Division and Fellowship Director of the Minimally Invasive Gynecologic Surgery Division at UNC. I'm an Associate Professor. Minimally invasive gynecologic surgery is when you would try to treat diseases through minimally or small incisions. And that's captured, I think, very well in the name. However, the division is pretty broad. So it does address surgery if it's needed, but we also have a wide array of other treatment options for patients. I would consider us more of complex, benign gynecology. So we treat a variety of pelvic, sexual pain, and then also diseases that may benefit from surgery, such as abnormal uterine bleeding, uterine fibroids, endometriosis, adenomyosis. And then we also have a group of a physician and advanced practitioner team who does vulvovaginal diseases. So this is going to be vulvar pain, recurrent vaginitis, menopausal symptoms, and sexual pain with menopause. So really, it's a pretty broad group of diseases and treatments that we offer that is housed under the name Minimally Invasive Gynecologic Surgery. Our team's approach to patient care is partnership, and we really support shared medical decision-making. So we want to understand what treatments you've tried in the past, what's worked, what hasn't worked, what your future goals are, whether it's fertility or less pain with intercourse, or making sure that you can go to college and sit in class and pay attention. So it's really understanding those goals. I think that sets us apart. And we hope to provide additional tools and education in order for you to be successful. I believe our division is set apart from other teams that offer minimally invasive gynecologic surgery and treatments for conditions like fibroids and endometriosis and pain by a couple of things. One is, I think that we try to partner with the patient at the very beginning. So it is the most simple shared medical decision-making approach for most patients. And I think that works really well in the space of benign gynecology. So we try to empower our patients to make decisions that reflect their goals, their personal beliefs, like kind of what they are expecting and what they're wanting to achieve from treatment. In addition to partnering with our patients, we do try to offer guidance regarding evidence-based medicine. There is a lot of misinformation in female pelvic pain, female sexual pain, endometriosis, fibroids that we try to help navigate. So we hope that we can really be a sounding board for our patients, especially when they hear about something that they might want to try, really building a partnership of trust and letting us help guide and explore that with them. I would like patients who are searching for a gynecology team to know that we're experts in the field. And so we come to the appointment really prepared with an understanding of what's working, what hasn't worked, what are emerging treatments and techniques, both medicine and surgical, trying to support the patient's wishes and goals, but aligning that with what is best practice and what is supported by medical literature. Our team includes 5 fellowship-trained minimally invasive gynecologic surgeons. So all 5 of the surgeons have completed a 2-year surgical fellowship. 2 fellows, so we have 1 fellow per year, and we actively train leaders in gynecologic surgery. And then we have 2 APPs, so advanced practice practitioners who support our clinic. And so when we talk about our team, your care may include a variety of team members, so including the surgeon, a fellow, and an APP, as well as our really strong nursing team. We have 3 RNs, 2 CMAs, and people who are really available for phone calls, messaging, making sure that we're answering your questions in a timely way. We have offices both at Hillsborough, just off of 40 at the UNC Hillsborough complex, and then we also have offices in Raleigh, and we plan to have a more permanent presence in the Wake County area, which I think will be really helpful for our patients, especially in Wake County, in Raleigh, and then also coming from the East Coast. We serve patients all over the state, all over the region. We have a lot of patients who travel to us, and so we understand that it can be challenging to reach even these 2 office sites. We also offer virtual visits, which I think has been a really important part of our practice. It allows us to reach patients who do have a distance to travel, especially for patients when we are just maybe your first consult, maybe your follow-up care that may not require a physical exam. We're able to offer other options, not just an in-person visit.